And I'm here this morning because of the virus. But I would be here this morning even if the virus had not struck our community and our state, our country and our world. The issue of domestic violence and preventing it and helping the victims is one that has always been a top priority for me. I commend the governor and everyone in the state for what they've done to lower our numbers and combat this pandemic. But all along, I've been so worried about the collateral damage, as they term it. And that's really the wrong word. About the unseen victims, the toll it's taking on people in our state, and particularly those who are suffering at the hands of abusers. We have seen, as I feared, record increase in the numbers of calls to domestic violence centers, texts. Calls went up by almost 100%, 17,000 the same period last year, compared to almost 31,000 this year. And 282% increase in texts for help from people confined at home who could see no way out. A study was recently published looking at women in Brigham's Hospital in Boston. They saw twice as many abuse cases in the same period as they had seen in the prior 2 years combined. This has to stop. We have to do more to help those who are at risk, to give people like Kathy Verano and Safe Futures and all the other organizations the resources they need. And that is why I'm going to be working with my colleagues on a bipartisan basis to introduce legislation during the special session to increase funding for domestic violence prevention. Now, Karen Jarmick from CCADV has made a very modest request that we as a state find $250,000 to support the costs of hotels. If you have a shelter now, because of the pandemic, you can't put as many women and families in there. You have to find hotel rooms for them. This is a huge unexpected cost. Added to that, the cost of PPE, all the extras. $250,000 is a pittance when you consider the amount of money we save in terms of lives saved, children saved, resources saved, really giving people that outlet. We currently have $362 million in coronavirus relief funds unspent. And there's $544 million in last year's state budget that is sitting there. So I am calling on my colleagues, join with me. I'm calling on the governor, join with me. I'm calling on everyone in this state, join with me as I work to get this additional funding through special legislation in the special session, through moral suasion, whatever it takes. Because $250,000 is nothing compared to the dividends it will pay when we save lives and give victims and organizations like Safe Futures what they need to carry out their mission. So now I'm going to let Kathy Verano, Executive Director of Safe Futures, whom I would be hugging like crazy if we didn't have to socially distance, a chance to tell you what she sees during these days.
So Safe Futures, formerly the Women's Center of Southeastern Connecticut, is celebrating its 45th year in 2021. In my 26 years here, I have never experienced anything like our pandemic. But who has? But we're a crisis intervention agency. We work the best in crisis. At the onset of the pandemic, I remember Jeannie Milstein, New London Aid Human Services, and Steve Fields saying, guys, we have 2 weeks in Southeastern Connecticut to prepare for this. And that was such a gift. What we were able to do in those 2 weeks, more so than our sister agencies around the state, was designed plexiglass plexiglass sliding barn doors for our shelters, for our counseling offices, transitional living programs, so victims could have face-to-face conversation in a trauma-informed manner, so children could sit on the floor and work with our child advocates with just a shield between them. They've been through enough trauma. They didn't need to be traumatized more in our shelters. We were able to purchase laptops, cell phones, so if we had to go remote, totally, we were prepared. We were very fortunate. We stayed open the full time. Our essential staff was here at our counseling office, in our Norwich office, in our shelter, our transitional living programs, and our courts, where 35% of the criminal docket are domestic violence cases. In New London, Captain Wright, New London Police Department, reported in April, domestic violence calls were up 33% over last April, same time period. So when I realized at one point during the pandemic that we had 54 children in our shelter, hotels, and residential programs, where everyone was like, oh, that's so daunting, I was ecstatic. Because I knew our victims were coming for services. We were here. We wouldn't turn anyone away. We were able to give hope to 43 families during that time. And it starts here. In 2019, Safe Futures housed an additional 414 bed nights in hotels, costing $7,000. That's in addition to our regular shelter, which was over a capacity of 123%. In 2020, that $7,000 increased to $62,000 and 1,540 bed nights, additional bed nights, besides our overcapacity at our shelter, where we average 1,500 to 1,800 bed nights a month. Besides that, we were able to permanently house 14 families. Remember, Safe Futures covers 21 towns in southeastern Connecticut to include 2 cities. Our numbers increased 25%, yet 2 casinos were closed and 2 law enforcement departments. We did that with the work of our team, our child advocates, our counselors, our facility coordinators. We could not do this without our community, our law enforcement through lethality assessment program, referring victims immediately for us at risk of being murdered to our shelter, our court systems. And what we have seen is increased numbers in strangulation, multiple strangulations, increased physical abuse. With multiple strangulations, we know the effects on victims can be traumatic brain injury, miscarriages, stroke, life-altering conditions. Substance use is up due to isolation, no child care, food, job loss, and children are home. We need funds. We need funds to maintain our shelters, our children in our shelters, our victims in our shelters, to give them hope. We need funds for our child advocates, and we also need to look at our virtual restraining order process so victims have access to our courts. I thank you, Holly. I thank everyone here, and I'll turn it back over to Holly.
So I want to thank Kathy for allowing me to be here today. I want to thank all of you for coming. We've had a lot of cool acronyms for legislation coming out: CARES Act, HEROES Act, the HEALS Act. I'm calling mine Safe Haven. Supply additional funds enabling help for all victims everywhere now. I think that sounds pretty cool. So I'm going to be working on Safe Haven legislation in the upcoming special session, working with my colleagues on both sides of the aisle, because one way or another, we're going to get at least that $250,000 to enable hotel beds, to enable families, victims, children to be safe and find a better, new, wonderful life. Thank you.